Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Ann Hester. She's an internal medicine physician. Her Kevin MD article is titled, How You Can Thrive Despite the Looming Physician Shortage. Ann, welcome to the show.
Thank you. Thank you for having me.
So we'll get into your article in a little bit, but first off, briefly share your story and journey to where you are today.
Well, I am an internist. My father was a GP decades ago, and I spent a lot of time in his office as a child. And I was really inspired by all the people who would come up to me on the street and say, "Your daddy helped me." And that meant a lot to me. I didn't want to stay in school that long. So initially, I did not want to be a doctor. My older brothers became physicians, but I kind of held off. Unfortunately, my father had a fatal cardiac arrest before he learned I was going to go into medicine and follow in his footsteps. But something that really touched me was the song at the funeral. If I could help somebody, my living will not be in vain. And I took that to heart. And over the decades, that's kind of been my mantra. If I can make a difference, then my life is worth living. And so I've always had a desire to help people. Went to medical school. I graduated in 1992 from the University of Tennessee in Memphis, and then I went on into private practice. And then my husband and I moved to the East Coast so I could have a kinder, gentler job, so we could start a family together. And I've been a primary care doctor. Much of my career actually was spent as a hospitalist. And so I've kind of run the gamut. And I started with my passion of empowering patients back in medical school. As a third year student, you remember how hard it was to have time off. And when we had time off, a lot of my partners, my classmates were out doing fun things, but I just felt like I needed to get started helping people even before I had the MD. And so I wrote my first book. I self-published it, self-help book, decades ago. And subsequent to that, I wrote another more general self-help book. It was called Your Family Medical Record, an interactive guide to getting the best care. And John Wiley published that 23 years ago. But people didn't really seem to care that much about empowerment. And then a couple of months ago, November of last year, I republished the best parts of that, and I added a lot more. A book called Patient Empowerment 101, More Than a Book, It's an Adventure. And so my passion has always been about uplifting and empowering people.
Wonderful. And with your decades-long experience with patient empowerment, you wrote a book on it. Just tell us, what does patient empowerment mean to you?
To me, it means that patients are equipped to center themselves in the middle of their healthcare team, that they don't just rely on what the doctor and the nurse and the other people tell them, that they actually know what's going on. They know the questions to ask, and they know how to communicate with us. I once timed a very loquacious patient, and I knew she was going to take a long time. I asked her a yes/no question. It took her 10 minutes because she sat there and she thought about it, and she went around the block many times before she came to her answer. Now, if we think about what that means to us as clinicians, when you have a patient, a nurse who can come in and hit the bullet points right on, it expedites the diagnosis. It narrows down the list of possibilities. So you don't need to order all these tests and procedures. You have a short list, so to speak, of what you think is going on. And that translates into a speedier diagnosis, fewer tests and procedures, some of which can be painful, expensive, and even dangerous. Less of a need for trials of medications, fewer follow-up visits to see how the patient's doing. And so it's a huge win-win when patients are taught to communicate with us on a different level. And you don't have to be a doctor or nurse or have any healthcare background. I once did a lunch and learn session for a landscaping company nearby. And my audience was basically people who did the landscaping, groundskeepers. Most of them did not have a degree. And after 90 minutes, after doing the lunch and learn, we had a mock doctor patient session, and I did this with several of them. You would have thought that these people were doctors and nurses and had a long background, because once they're given the skills, they can partner on a huge level, on a level that we have not imagined, but they just need the information to be able to do that. And so empowerment to me means that patients can put themselves where they deserve to be, and that's at the center of their team, and communicate with us nurses and everybody else on an unprecedented level.
All right, let's talk about your KevinMD article titled How You Can Thrive Despite the Looming Physician Shortage. Now, tell us, how did this article come together?
It all came together based on the book, Patient Empowerment 101, and my desire to teach people what they need to know. For instance, we know we can't just charge whatever we want to charge for a visit. We have to look at the evaluation and management guidelines. Realistically speaking, those 8 bullet points, the severity, location, duration, and so forth, those things are important, not only to substantiate what we did for the patient and the complexity of the care, but also because if you cannot substantiate those things, then you could be in trouble with your billing. Patients don't know these things. If patients knew, hey, I have abdominal pain, let me go through these 8 bullet points: the severity, the location, the duration, the timing, exacerbating and relieving factors, and so forth. When they walked into the doctor's office, they could give a 60-second elevator speech, help the doctor narrow down the list of diagnoses, and expedite their own care. They just need the tools. And so this article came about because I really want patients to understand what they can do differently. And it's not complicated, just some very basic things that they can do to expedite their care, decrease the time of suffering, and lower their medical bills. And that is a huge win-win, not only for the patient, but for the doctor, who needs to get to see the next patient and spend more time with that patient because that patient is sicker.
So tell us about some of these tools that patients can use in the exam room to facilitate this.
Well, for one, I really advocate that people prepare in advance, prioritize their concerns, because when patients come in with the list of what they saw on the internet and a long list of issues, and you only have a few minutes, they often don't get to what they really need, they really want to address. So they prioritize it. They prepare in advance those bullet points I stress in the book, and also in the book I go through our FAQs. If you have abdominal pain, we know what we want to know. We know, you're having nausea, vomiting, black stools. We know those things, but they don't. And often they sit on a cold examining room table angry because the doctor is a little bit late, or maybe very late getting to see them. And they try to pull together the history then. That's not the best time. And we all know that when they try to do that, they can be very circumferential and miss important things. And so I stress the importance of advanced preparation. I go through a variety of common symptoms, abdominal pain, fevers, diarrhea, and so forth, and give them the things that we're most likely to ask. So when they go and they see the doctor, they can go through those things quickly. And so I also encourage people to know their medical records, to have a copy, a concise, organized copy of their medical records. Because when they go from doctor to doctor, or even if they end up in the emergency room unexpectedly, they need to know these things. They can't say, I take a little white pill. A lot of people are familiar with that notorious little white pill that we have no idea what they're talking about. And so I really just try to get people to pay attention to details, and you don't have to get into the weeds, so to speak. I ask them to get things organized in a step-by-step fashion. So a doctor can open up their medical record, the 3-ring binder, or the companion guide that I made for this book, and see at a glance medications, medication allergies, family history, past history, surgeries, and so forth. Just like we keep a medical record, I encourage them to keep a concise copy of their records for emergencies and just for doctor's visits.
Now let's flip this from a physician standpoint, and like you, I'm a primary care physician myself. What are some things that physicians can do to place patient empowerment in the center? And especially, as you know, with increasing obstacles, bureaucracy, time pressures, what are some things physicians can do to empower patients?
You made a good point about the time frame. There is a lot going on, and the AAMC has predicted a physician shortage of, I think, about 124,000 doctors, maybe in 11 years from now. And so our visits now are going to really be abbreviated. Patient empowerment means different things to different doctors. So if you know your practice is set up in such a way that if your patients come in with a list of prioritized questions and you can go through those questions expeditiously, then let them know that if by preparing in advance, you want them to go through the bullet points of those 8 HBI elements, you can give them that information. You can give them handouts, brochures. You can create your own literature. You can put it on your website, in your patient portal. So you have to prioritize what's important for your practice. What works well for a gastroenterologist may not work so well for an internist. So what you need to make your practice run more smoothly and to empower your patients is what you would focus on. And the means that you would do it would vary. If you have a primarily Medicare population, those tools are going to be different than if you have mainly 20, 30-year-old patients who are very healthy. And so each doctor can look at his or her practice and see how things flow and envision how they could make those visits more effective. And then they would tailor patient empowerment to what they need and what their patients need.
We're talking to Ann Hester. She's an internal medicine physician. She's the author of the book, Patient Empowerment 101. More than a book, it's an adventure. Her KevinMD article is titled How You Can Thrive Despite a Looming Physician Shortage. And you did touch upon the looming physician shortage, especially in primary care. Now, for those medical students who may be listening to us today, give them some reasons why they should consider primary care as a career.
Primary care gives you so much potential to change lives. When I was going through medical school, the subspecialists were the ones who were really lifted up and, very important, so to speak. But if you think about it, how many people die of a ruptured appendix? How many people die of a neurosurgical emergency? As a primary care doctor, you can impact people from A to Z. You have impact over their emotional well-being, the preventive aspect is huge. Lifestyle medicine is gaining speed as far as using lifestyle to even reverse diseases. I remember I had one patient when I was a primary care doctor, and I used to always get on him, always kind and respectfully, but I would get on him about, weight management, things that he could do differently. And he stopped coming. And then he came back maybe 2 years later. He said, Dr. Hester, I wanted to wait till I had lost 100 pounds. I've lost 99, but I had this bad bronchitis and I just had to come in a pound early. And so because of that counseling, this gentleman lost close to 100 pounds. So just imagine the impact that that had on his life and life expectancy. And so you're able to develop relationships with people that a lot of other practices, a lot of other specialties just are not able to do. So again, my father was a primary care doctor. He was a GP. I was an internist. I spent a lot of time as a primary care doctor. Then I went to primary care / hospital medicine. Then I moved to hospital medicine. But some of the most precious times of my career were those times like what I just mentioned. I ordered a pizza one day and opened the door, and the pizza man said, Dr. Hester, you saved my life. You diagnosed the DVT. There are certain things that will always stick with you. And primary care physicians, they have a hold on medicine and on their lives that is really just hard to match. So I would strongly encourage everybody to strongly consider medicine, primary care medicine, because you can play a tremendous role over a long period of time in the lives of your patients and their families and their communities.
We often hear about some of the obstacles to medicine in general, and especially primary care, whether it's bureaucracy, electronic medical records, there's an increasing rate of physician burnout. How do you persevere through those challenges and maintain those ideals?
I think that people morph, and you have to determine where you are, be honest with yourself. For me, when COVID hit, and I was able to spend more time with my children, and I am in my 60s. I decided it was time for me to make a change for my family. Teenage girls, they needed mom to be home more, so that was the time for me to make some changes. Before then, I was a primary care doctor, working crazy hours. I wanted a family, and I couldn't keep that up as a private practitioner, and I had to morph into working for an HMO. And even as the primary care doctor in the HMO, I ultimately transitioned to doing a lot of hospital medicine and then into hospital medicine. And so, in order to decrease your risk of burnout, be honest with yourself, prioritize what's important to you, your family, your work-life balance, and then you can determine what fits for you. If you find a good fit and you're happy with what you do, you're far less likely to burn out. If you stay at something feeling that people expect you to do it, that you need to do it, but deep down you're not happy, you're not going to stay. And if you do stay, you're not going to be happy.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
A big take-home message I have is that we as a country are like a ship sailing gently into a tidal wave that has the potential to sink our ship. We as physicians, we're like the admirals of our healthcare system. The APPs, the nurse practitioners, the PAs, the CRNAs, and so forth, they are vital. You have to have the providers, the captains, the nurses. We can't do it without them. But we haven't really taken full advantage of the healthcare consumers, the seamen. There are so many more of them than there are of us. We need to equip them. We need them on our side. We need them to be in the battle with us. With this looming shortage, we must be strategic. We must think outside the box and come up with innovative ways to strengthen our healthcare system in spite of what we face. And so it means different things to different people, different things to different hospitals, different things to different practices. But evaluate where you are, where you think you may be in 10 years. If we really have that sort of huge shortage, it doesn't matter what kind of insurance the patient has. If we're short over 100,000 doctors, you have so much time you can spend with any given patient. So look into the future, start making plans so you can help protect your patients, the community, and keep your practice thriving.
And thank you so much for sharing your time and insight. And thanks again for being on the show.
And thank you so much for having me.